everyone. Welcome to another exciting episode of the Insurance Untangled Podcast. I'm Naren, one of the co-hosts of this podcast, dedicated to helping practices that are tangled up with insurance. We talk about topics that help you take more control and create a bigger and better future for you, your patients, and of course, your team members. Today, my guest is my dear friend, Ben, and the topic we'll be discussing is the challenges with perio billing and perio denials. Ben, welcome.
Hey, Naren. It's great to chat with you today.
Yeah, looking forward to this conversation. I think this is something that's in a lot of people's minds. So I hear that denials for perio-related claims are on the rise these days. Why is that?
Oh yeah, so for periodontal disease, gum disease, it's sort of becoming one of those areas where the increase in utilization, there are more and more practices performing perio-related treatment. So as far as utilization, it's creeping up there, and that's causing insurance companies to sort of figure out ways on how to reduce the claims payouts. And so naturally, you do see a lot of denials in that area. Funny thing is that the number one most billed code in a general dentistry practice is a pro fee, D1110. But the interesting thing is that the perio related claim should be high up there as well, based upon the statistics of like percentages of people that do have gum disease. But the insurance industry knows that, and so they've been really pushing back to sort of discourage doctors from submitting perio claims. The sad thing is that the treatment is being done, but the claim submission side of things, they're just not being submitted to insurance, mostly because whether it's misinformation that the insurance companies are sharing or a misunderstanding on the dental offices, there's just very poor performance in this area among most dental practices, in the sense that they just don't report what they need to be reporting to the insurance industry, or at least on the claims. So with that said, it's in large part, Naren, an effort for insurance companies just to reduce the claims payout, and that's what it boils down to.
Perfect. Perfect. Thank you. I have another question for you. If you were to guess, what percentage of adults do you think have periodontal disease?
Yeah, so I actually pulled up the statistics from the Centers for Disease Control. And so here's what they say. They say about 4 in 10 adults over the age of 40 years old have mild, moderate, or severe level of periodontitis. So this is between the years of 2009 to 2014. The latest reporting, I did read something where it said that the rate of periodontal disease among adults is closer to 70% these days. And I hesitate to mention that as an official statement, mainly because there are some differences in how the Centers for Disease Control and other institutes quantify those numbers. But in short, the numbers that I have been able to verify is that about 1 in 2 men and 1 in 3 women ages 30 years or older have some form of periodontitis. So with that said, like when you look at your pro fees, like what you see in most dental offices is a significantly high amount of, well, an appropriate amount of pro fees, but little to no gum disease, like peri maintenance, 4910s, or 4346s, which is the gingivitis cleanings. It's very underutilized in dental practices, but the interesting thing that I see is that the work is being done. It's just not being reported to insurance, So, but yeah, about 1 in 2 men and 1 in 3 women have some form of periodontitis.
Thank you. Now, what do you think is a good performance when it comes to a practice, in terms of periodontal perio disease, and then of course perio performance, and of course, what are you seeing the average practice? How is the average practice performing?
Yeah, so Dr. Gordon and Rella Christensen have both really been pushing for this for many, many years. And I think most dentists would recognize the name Gordon Christensen. He's mentioned in every school, dental school across the country. They recommend perio performance to be about 30%. Some would argue, some other experts would argue that it should be closer to 40%.
30% of production?
Now, 30% of your prophies or people that are receiving some type of cleaning in the dental office.
Oh, okay, got it.
It's 30% of the adult patients that should be in that category of periodontitis in terms
Right.
of claim submission, right? In most practices, you see that number well below 10%. In some practices, below 5%. I mean, I even have clients that have a 1% perio performance. And in large part, a lot of these practices don't have that as a focus, so they do tend to refer to the periodontist consistently. Even for things like scaling and root planing, you can do that in general dentistry practice, but some doctors just send it to the periodontist to deal with, mainly because of the complexities with insurance or just simply being understaffed. It's hard to find hygienists these days, you know, and so many practices have elected to not deliver treatment for perio disease. But when I look at the charts for those practices, it's interesting because they're doing the treatment. The treatment is being done even in practices where their perio performance is 1%. You look at the records, and yeah, you have all kinds of indications of bone loss, attachment loss, all the factors that would indicate periodontitis. Those are still being performed in practices that have very low perio performance. But you know, 30% or above, it makes a big difference in terms of just the practice dynamics, especially the revenue component, simply because in most practices, you're delivering a bloody prophy to a patient and you're getting compensated about 20% of what you should be getting compensated for the actual treatment that's being delivered, right? And the materials that you're using and the medicines that you're using. Like I see a lot of practices use antimicrobials on soft tissue, you know, that which promotes soft tissue healing. I think the most popular product for that in dentistry is called Arestin, and that's being delivered, but not even billed out to the patient or insurance. And so we got to be careful with these initiatives because it's a money factor, right? You cannot sustain practice, you know, hygiene wages and the increase in terms of the inflationary aspect of dentistry if these things aren't being reported, right? So with that said, yeah, it's low performance, below 10% in most practices where it should be at least between 30 and 40%.
Yeah, that makes sense. I think even my experience, 30 to 40% is a reasonable number. I even have practices that expect a certain percentage of their revenues to come from perio, you know, as a benchmark.
Oh yeah, for sure.
Why do you think most practices are not performing well when it comes to perio?
You know, it's a delicate issue. It's one of those areas, and I'll be totally upfront about what I'm seeing, is that there's sort of a unique relationship between the doctors and the hygienists. And it's one that has to be sort of navigated very carefully, right? Where it's sometimes a challenge to get hygienists to implement a protocol that they're uncomfortable with, right? And it could be a money factor. You know, like for instance, there are some perio codes that would require patients to pay out of pocket, whereas a prophy code, there's no out of pocket for a patient that has insurance, right? And so my observation is that the money side of things, there's some hesitation in terms of a knee-jerk reaction among the patients. And the liability with that, there's two areas of liability, Naren, is number one, patients, they may be receiving the message from the hygienist that, hey, you have a condition here and that you need to focus on. But when you look at the notes and how the claims are submitted, it's a prophy. It doesn't mention anything about gum disease at all. And I wonder if patients are getting the right messaging about their oral health condition. You know, at the end of the day, it's not the clinician's fault when a person has declining health, unless that person's been going there for years, you know, naturally not getting the advice and the right, you know, medical information for them to know that they have a condition. But I think it has to do just with the co-payment mechanism, where my observation is that a lot of times it's just easier to bill out a prophy and not get the patient upset, right? But I don't think we should really use that as a fear point in terms of how we present to patients, mainly because number one, the liability issue with not reporting perio is that it's considered supervised neglect. Even though you perform perio, on the patient if you submit the claim as a pro fee. There's no way around it. It's documented as a pro fee, so therefore it becomes a liability issue as it pertains to supervised neglect. And many practices get sued for things like that, right? And they lose those cases all the time because they may have delivered the right treatment, but the record indicates otherwise, right? And people take advantage of that. When people know that, some people sadly will take advantage of that and sue you. So with that said, documentation-wise, informed consent-wise, income-wise, those are the factors that you're dealing with when you're not reporting correctly. But on that part there, I think the challenge with most practices is just the co-payment component and the fear of patients having a negative reaction because they have to pay due to the fact that they have poor health, as a patient.
Right. I hear that HMO practices that do HMO capitation type dental plans don't diagnose things like perio. Why is that? Is it because I think I know the answer. Of course, they can't afford it. They're not going to pay for it. So, it's a pain to diagnose perio.
Oh, yeah. Yeah. So in capitation, well, when you're dealing with a capitation type of dental plan, so you're faced with getting compensated like $1 to $2 per patient per month. And there's an expectation among these plans that all the preventative care is covered under that payment. So you do the math on that. That's 12 to maybe $24 per year that you're getting to treat preventative care issues for patients. When for a typical dental practice, just the setup and the materials to deliver a single perio maintenance visit, that's not enough to cover a third of the cost, right? Or even in some practices, 10% of the costs deliver the appropriate treatment for patients, right? And you're right, that is the number one reason why it's not diagnosed in capitation-based practices, is because the practices themselves are the ones that will have to supplement the fees to pay for treatment. And so there's just a big disconnect. The clinical community is just, in terms of insurance for many, many years have just sort of going in the opposite direction, right? But yeah, those are the main components, is that HMO practices, they don't want to fit the bill to treat patients.
As we bring this to a close, any resources, any tips you have for us?
Yeah. So this is actually a big initiative for us, is to provide this awareness across the country with regards to the underperformance on perio, or more so just connecting the dots between, the billing components as it pertains to dealing with insurance and perio disease, periodontal disease, gum disease. The trend is indicating that gum disease is on the rise. The trend in dentistry is that we're doing a better job at reporting periodontal disease to insurance on claims, but we're not there yet. We're still far behind. So we've made an initiative to really focus on this year and spread the awareness that on the billing side of things, we could do better as an industry. So we do provide that education. If you visit our website, veritasdentalresources.com, you can find some educational resources specific to this topic. And we'll have a lot more articles and educational content made available on our website throughout the year. Yeah, but check out our website, veritasdentalresources.com, for more information.
Thank you so much, Ben. I really enjoyed our conversation today. And I think the topic of challenges with periodontal billing and periodontal denials is a good topic. And it's something that I think every successful practice has to pay attention to. If you enjoyed this podcast, share it with your friends and colleagues. Go to insuranceuntangled.com for this and other resources. Till we meet again, have a wonderful week ahead.